Hello and welcome to this Royal College of Pediatrics and Child Health podcast. I'm Kirsten Olsen and I work in our Membership, Policy and External Affairs division. In the next two episodes, we're taking a look at your well-being as busy health professionals. At our vibrant annual conference in Liverpool in June, we spoke with several members who are making a huge impact on well-being in their own hospitals and trusts. In this episode, we explore how to engage the whole team and really understand the needs of the people you work with. First, we hear from Dr. Ash Patel from the Birmingham Children's Hospital. If you remember, you may very well be familiar with his regular baking column in your magazine Milestones, or indeed his great paediatric bake-offs, which have been broadcast from our YouTube channel since the pandemic and made a physical appearance at the conference. Next, we hear from Dr. Susie Minson and Dr. Benita Morrissey, both from the Royal London. They had just come from leading their popular workshop at the conference, all about joy at work. They remind us how we might create enduring resilience and happiness in our working lives and bring along the whole multidisciplinary team. In our next episode on wellbeing, you'll hear from two more members on what they and others are doing with the college to help improve your wellbeing, so look out for that on your favourite podcast player. Enjoy! So if you can just introduce yourself and let us know why you're here.
Thanks. So my name's Ash. I'm a paediatric nephrology grid trainee and I work in Birmingham. I work at Birmingham Children's Hospital. And I'm here today to talk to you about wellbeing, which is a passion of mine and something that I'm quite interested in. And I'm sure you know me from the Great Pediatric Bake Off and from Ash's Baking School in the Milestones magazine.
Yes, so we'll talk about that in a second. But first we wanted to ask, what's your perfect Saturday morning, assuming you're not working?
So unfortunately, I've lost the ability to have a line anymore. So I'm generally up quite early on a Saturday. And if you asked me about a year ago, I would never have said this answer because I was never able to ride a bike before. But during the lockdown, I learnt how to ride a bike at 31 years old. And I have the cycling bug, and I've bought my own bike. And now I spend a lot of my weekends having cycling trips with friends or colleagues into the countryside. And I'm managing to cycle to work now. And I can ride about, also up to 35 miles on a weekend, which is amazing considering I was not able to ride a bike at all a year ago. So that's actually what I tend to do now on Saturdays.
Oh, fantastic. Sounds great. So you mentioned that you started the Great Pediatric Bake Off. For those of us who may not know, can you let us know a bit about it and how it works?
Yeah, sure. So I think it all started with my passion of baking, and I've had that for quite a while. And I had an out-of-program experience where I was a simulation fellow, and I enjoyed teaching immensely. And I made a pact to myself that I would actually make baked goods for every course that I delivered. And I just started it as a little bit of a hobby at that time. And I was quite good at it, and I learnt various recipes and baked various goods and had good critical feedback from my simulation family. And then that just kind of grew more and more. And then I always enjoyed bringing in baked goods to work. For me, I love, when it's so busy on the shop floor, or if you're doing a busy on-call, sometimes you barely get time to have a drink or have a bite to eat or anything. And actually, sometimes you just you crave those sweet things. And I think the best gift anybody can give you is a homemade baked gift, because I think it shows the passion and love that goes into it. And I really enjoy seeing other people eat my bakes. So I was doing that for work, and Aisling, who's the editor for Milestones magazine, she obviously saw some of my tweets.
Yes, so that's Aisling Beecher in our member services team.
So she obviously saw some of my bakes that I put on Twitter, and somebody had asked for a recipe for it. And so she contacted me and asked me to write a recipe down, which I did for the Milestones magazine, and that was a big hit. And then I said to her, I don't mind, I'm happy to do it as a sort of baking column, because there was a wellbeing section within the Milestones magazine already. So I contributed to that, and she was very much supportive of that. And then we had a bit of an idea in that, obviously we've been through COVID and this is our first face-to-face conference, but we've had some virtual conferences over the last few years. And so we had an idea of actually, why don't we do a virtual bake? And I put that idea to her and said, you know, I can teach some people how to bake, some college representatives or people well known within the college, because I felt that we didn't know them personally as much. We obviously know their titles, but actually don't know them as a person. And I think that's much more meaningful for people and for members to know them on sort of on a face-to-face value. So my friend Laura Kelly, she was the trainee committee chair at the time. So I approached her and said, look, you've just taken on this role. It'd be really good for members to know who you are and what you do, and what your role is going to be. And David Evans was also quite interested at that time. Yes. So we decided to do a virtual bake-off over Zoom, and we called it the Great Pediatric Bake-Off. In sort of a little knockoff version of the actual bake-off. And yeah, we pre-recorded it, and then we delivered it in the virtual conference. And from what Aisling told me, I think I had some of the highest views for any session in that conference. And it was a massive hit. And so we went from there and then just carried on baking and making bake-offs.
Fantastic. And so you've been speaking with a number of people in those bake-offs. Have you learned anything, or has anything surprised you as you've been speaking to people about well-being as you're baking together?
So I've learned a lot more about the college itself as a member, and I've actually learned a lot more about the groups that we have within our college. And I've tried to start sort of learning about those groups more. And I think as a member, I didn't know what a lot of their roles were or what they were working towards. And actually, I really wanted a feel of what they were doing. So we've done some with the Milestones team. I've had a bake-off with Camilla Kingdom and Jonathan Darling, who took up the post. And I just learned a lot more about who they are, first of all, as a person, but also about what their role was and actually what they want to get out of their tenure and what they want to do to improve paediatric health or improve paediatric services, or how to improve membership within the college. So I learned a lot about actually the role of the college and a lot about the people that are behind the scenes that a lot of people don't know about. There's some truly remarkable people in this college, and I'm very privileged to be able to bake with a lot of them. And during COVID, we weren't able to meet, and actually I met a lot of these people over Twitter first, and now I'm managing to, I was able to have a conversation with them, and it's built some relationships and friendships that I really didn't expect would happen. And I've made a lot more friends from this than I would have expected. So I think for me, it's given me a bit of education about the college, but also some lifelong friendships and colleagues for the future.
Oh, fantastic. So we're recording this at Conference 2022 in Liverpool, and you, of course, have brought your virtual bake-offs to the physical space. So I think you've done one so far out of a few. So can you tell us how those are going? That's going so far.
So it was quite daunting, actually, I must say. It was, this was an idea that I just brought up, and I said I would love to do this in person, actually, after doing it virtually. And I really didn't expect it to become a physical entity, shall we say. And the college have really supported it. And I think it's because people are quite obsessed with baking, or very positive and love it. Actually, I think our profession loves it and our college loves it. And it's a wellbeing activity that a lot of people can get behind. And there's a lot of paediatricians that bake. So I brought it to real life. And we hired some equipment, and I have a baking station in the exhibition centre, which I never ever would have dreamed of. And I feel like I'm like on a road show or something. And it's going well so far. I was a bit nervous this morning before the first bake, but there's people on Twitter that I've conversed with and never met before who were so happy to bake with me because they wanted to, and they wanted to meet me and I wanted to meet them. And they were so open to the idea, and I didn't need to convince them or anything. They were just on board already, which was lovely to see and hear. And so, we've just done the chocolate chip shortbread, which...
Sounds very tasty.
Yeah, they went down like a hit, and even the scraps and the slight burnt ones that I didn't want to serve, there was a couple, they still got eaten as well.
Fantastic. So finally, can you share any tips about how you would manage your own well-being at work, or perhaps how you would manage the well-being of your team mates around you? Yeah,
so like I said, it's something that's really important to me. And as I've become a more senior trainee, I've realised how important it is to maintain your own well-being, but also the well-being of the staff. And I think COVID was a classic example of actually how important that was, to look out for your colleagues. And actually, we need to look after ourselves because we're the workforce, and without us, nothing's going to progress, and we can't deliver a service. So it's something I'm more mindful of now on a day-to-day basis. And I like to check in with people. I want that time to not be doing medical work and actually having some non-clinical chat. And I use baking as a way of doing that. So actually, an initiative that I brought up was Fat Fridays.
Okay.
So we would have a cake. I started off the bakes, and then I said, everybody, I think everybody can bake in this team. Let's all try and do a Friday. So people would sign up and they would make a bake, and we would try it. And I even made it a little bit competitive in that I gave some scores, but that brought out the best in people as well. So that's some of the things that we've done locally, and I've supported sort of well-being rest areas and facilities for doctors overnight. And I think it's a day-to-day thing that we need to be consciously thinking about, making sure that our team is taking breaks. And it doesn't have to be like workshops or yoga sessions every day, or sort of psychological sessions over Zoom or anything like that. Or I think it's just really simple things. And actually, it's really important to just talk to your team, because there's so many little changes that you can make within your little department that will have a huge impact on other people and a huge impact on your team and make their working life easier. Because I think we're all quite resilient, I think. And actually, if we can make the working day a bit better, I think that's a positive for me. And so that's what I try and achieve. And that's what I try and tell people if they're thinking about a wellbeing initiative. Think about actually what the team really needs. What is really bugging them at the moment? Is it because there's no hot food on site today, or they couldn't get parking this morning, or the ID badge is not working and they haven't got IT login? There's really simple things that you can actually fix and make their day better.
Great. Oh, those sound like excellent tips. Thank you so much, Ash, for your time.
Thank you.
Speaking with Dr. Susie Minson and Dr. Benita Morrissey. So welcome, Susie and Benita. And first, I wondered if you can just tell me your role and briefly why you're here at conference.
So I'm Susie. I am a consultant paediatrician at the Royal London Hospital, and I work less than full time. And I always love to come to the conference. I feel like it's such a nice opportunity to meet other colleagues, meet people that you don't get to see in your everyday working life, and also a chance just to hear about really exciting advances and improvements in child health, and really think about how you can apply that to your own practice.
I'm Benita. I also work at the Royal London. I've got a joint appointment with Barts and London Medical School, so I also teach and oversee the child health teaching there. And I'm here at the college conference just for the day. We had the exciting opportunity to run a workshop on joy in work earlier today. So I'm here particularly to do that, but also to connect with people and get energised and inspired by some of the other things I've heard.
Brilliant, yes. And we'll talk more about joy in work and well-being in a moment. Thought we'd kick off at first to ask, what is your perfect Saturday morning?
Great question. So I live in East London. I love running. I find it a fantastic way to just to get some space, to process stuff, to pray through stuff. So I would say probably a long run up the canals of East London, followed by brunch with some friends.
Nice.
I love Saturday mornings. I would say, so I'm a super early bird and I always wake up really early, whatever day it is. But I do love that time at the weekend when you're the first person up in the house and you just have a little bit of time just for yourself. And I think that's super precious. So I sometimes like to do something outside as well. I have been known to run and have bumped into Benita before, but also sometimes just a bike ride or even a swim. And then I also love when I get home, if there's a chance to just have a more chilled morning with my children, and we might all sit around and even just like watch cartoons or make pancakes or something that you couldn't do on a working or school day. That's really lovely.
So wanted to ask, why is wellbeing for paediatricians such an important topic to discuss, and why is it important now?
I mean, I think it's always important, and I think there's sort of different themes, aren't there? There's sort of things that are about for us as individuals, and maybe how we, feel about our work and our lives, and recognizing that actually working in healthcare is a long slog in many ways, and it's sort of very much a marathon and not a sprint. And trying to really think about how you can create like enduring resilience and sort of happiness in your working life that will allow you to sort of continue with that. But I suppose also there's something more about, recognizing that well-being isn't just a nice thing that goes with work, but that also has implications in terms of patient outcomes and things. I don't know if you...
Yeah, I mean, I think it's always been important, wellbeing. I think now it's particularly important coming out of COVID. I think there's an increased focus on it, and also recognition that as a workforce, I think Seb said it very well earlier, sort of there's an epidemic of burnout.
Yes, subgrade.
Yeah, not just amongst doctors, but also amongst nursing staff, amongst healthcare assistants, and it kind of impacts on kind of people at all levels. So I think it's really important that we look after, and our workforce can not only survive but can also thrive. But I think it's also, as Susie says, incredibly important for the children and families that we provide care for. There's evidence that a kind of happy, engaged workforce, there's better outcomes for children and young people. They're more satisfied with care. There's less errors. There's improved kind of retention for staff. So kind of across the board, I think it's really, really important. And I think we're delighted that there's such an increased kind of focus on it now at all levels, which is really fantastic.
Yes. I suppose when thinking about implementing wellbeing programs in one's trust at work, how do you find out what's actually going to really work, what's going to stick with the people that you work with, and the kind of structures that you're working in?
Yeah, I think that's a fantastic question. I think when we started looking at how we work across quite a large children's hospital to improve wellbeing, we found it a bit overwhelming. We recognised there was such a diversity of what's important to staff, so many different staff groups, and we didn't really know where to start. And we actually found that IHI Joy in Work framework really helpful.
Yeah, absolutely. Because I think exactly as you say, it can feel quite overwhelming. And I also think you often have maybe ideas of things that you think might be the answer, but you don't really know. And we were very conscious when we started that sometimes we both had experience of wellbeing initiatives that had been quite sort of top down and just introduced, but maybe then, hadn't always had the success that had been intended, partly because people didn't really feel that it was relevant to them or that it was meaningful. So we were really keen to sort of to start by finding out what did really matter to people and having a framework around that. So because we knew that whatever we did, we wanted it to have positive impact. So yeah, I think that the framework around thinking about how to ask those questions and what to measure is really powerful.
So yeah, we started with quite a big consultation across our kind of hospital, and we tried to kind of particularly target some of the harder to reach groups. So cleaners, healthcare assistants, medical secretaries, people that wouldn't necessarily think that these things were for them. And we just asked them 3 questions. What makes a good day for you? What gets in the way of it? And what do you think we should work on? And we used free food as an incentive to draw them along. And we tried to kind of use different ways of collecting data. So we used Post-it notes, we did focus groups, We just spent time really kind of listening and helping people to feel heard. And then when we got all that feedback, which we probably got from over 100 people actually, then we kind of looked at it kind of using a kind of qualitative framework to try and pull out key themes of what was most important to our staff.
Great. And what were the themes that were coming out when you got those responses back? And were any that surprised you?
Yeah, I mean, it was really nice. There's one thing we had really wanted to recognise from the beginning was that it would be different things for different people, and that was sort of part of the process. And I suppose one thing we really found, didn't we, was that if we, even just that process of asking people and having that sort of conversation and making it clear that we really cared what people felt, I think was powerful in itself, and people felt that we really wanted to listen. So that was really good. But then there were some really key themes that emerged, and we can't fix all of them at once, but I mean, some of them were people really wanted to feel appreciated and valued in their work. People really wanted to work in a sort of positive and supportive environment with in a team that they felt recognised them. Kindness was a really common theme that came up again and again. And then, there were, to be honest, some things which felt a bit more daunting to try and tackle, such as, lots of the responses were around IT and sort of logistical solution things that it's quite challenging, but, equally, I think completely valid, and that I can see how the frustrations around those things can really impact on your experience at work, and sort of resources around places that people take their breaks was also another really key theme. So things like whether you've got a microwave, it sounds small, but like if you've got a microwave to heat your lunch up, or somewhere nice to sit for half an hour, really made a big difference to people. So yeah, we had people were really generous in their sharing with us of the things that, and I felt people really reflected on what would make a difference. So yeah, we were able to kind of collate quite a few things, but then of course it was quite daunting, wasn't it, to know what to do with all this information.
Sure. Can you talk anything about how you went about implementing some of the initiatives kind of after you captured that feedback?
Yeah, so I think key for us was recruiting a diverse and enthusiastic team. And I think that's probably one of the things that helps with the success of it. So we kind of went around the wards and chatted to some of our senior nurses and asked them who they thought would be good. We also kind of chatted to our managers about who had a little bit of capacity to be involved in this. So we had a team of kind of doctors, kind of all level of kind of nursing staff, and we later brought in kind of allied health professionals as well. And I think we all just met together as a team and we just brainstormed ideas. We aimed to kind of start small, and if stuff worked, to kind of roll it out, but also not to be afraid to fail, and to kind of accept that not everything we do is going to work, and some things will just flop, and that's totally okay. And I think we also recognise that some of what we were trying to create was real cultural change, particularly around cultures of kind of positivity, kindness, kind of valuing, appreciating people, and that will take a little bit longer to kind of develop and grow.
Can you give some examples of some initiatives that you put forward in your trust and how those worked?
I think one thing that was really clear to us was that, we wouldn't be able to just do one thing that was going to be the solution for everyone, because we recognise that everyone's different and different things will work for different people. So we very much wanted to make the solutions and the initiatives owned by the people that were going to be working there and owned by the team. So we had some things that were sort of aimed at the whole children's hospital, the whole department, and then some other initiatives that were a bit more local and just for small groups of people that would be more meaningful for them. So maybe we can give you an example of each. So for the whole hospital, something that we did that was super popular was just a sort of every couple of months having a wellbeing lunch, which was a shared lunch for everybody. So it brought everybody together, and we really made the effort to go around and encourage everyone to come, like not just the doctors and nurses, but like the admin staff and the housekeepers and our porter, and really try and make them as inclusive as possible. But they were also then an opportunity to talk about wellbeing and then keep it on everybody's agenda, but also to kind of have a two-way sharing conversation. So we used it as a chance to celebrate good work and to create positivity and really try to make people feel valued. And I feel like that was a really nice whole hospital initiative that promoted wellbeing and team building.
Another example of a kind of a slightly more local initiative is we had a couple of practice development nurses on our team, and one of the areas they recognised needed improvement was around student nurses that were transitioning into being kind of newly qualified nurses. And what had happened previously is that they were kind of in a big system and felt a bit lost and that their voices weren't heard. So they created a specific kind of preceptorship program for them, which included a kind of wellbeing element where they kind of really supported them as individuals and supported them in that transition. And they even did things kind of a year kind of on, they sort of went round and took them all kind of thank you presents and cards and wrote kind of personalised notes about how far they'd kind of come on in the year. And they looked at actually our retention rate actually since they made those changes. And encouragingly, they found that it had improved from kind of 72% to 89%, which is a huge improvement in terms of like staffing, and also really addresses one of those other issues that everyone said was really important, which was having the staff to be able to deliver kind of high quality care.
Were there any particular challenges that you found, as you mentioned that of course welcoming failure is sometimes part of change, but anything that you found particularly tricky to do?
I mean, I feel like there's lots of things that we found, that we've learned along the way that were challenging. And I think one of the things that's really become clear, we've done this over, there's lots of different things we've done, but it's over quite a long time, isn't it? Probably like 3 or 4 years now. Mm-hmm. And one thing that has really become clear is that there is a sort of need for constant momentum in this and in kind of it keeping up momentum and encouragement, and really needing to have those local champions. So I think it is quite sort of resource intensive in that sense. And there's maybe also been something about recognising that obviously well-being is something that we feel is important for everyone, but when you're doing this work, there are times when perhaps people need a bit more support than your intervention is maybe able to give, and we recognise we don't necessarily have the resources and the skills to offer the psychological support that some people might need. So I think really having a clear framework of escalation and safe signposting for those individuals has been really helpful, because you don't want to feel that you're not offering, able to offer someone something helpful. And then another thing we were just talking about in our workshop actually is that one of the things that's both a challenge but also maybe a positive in paediatrics is because our junior staff and our nurses, that people rotate around a lot, don't they? So right. We may have someone join our team for 6 months or a year and they might get really involved in one of these initiatives, but then they'll rotate somewhere else. So then that's the challenge for us as a kind of institution, is that then you sort of lost that momentum and that skill. But on the other hand, they might share that initiative with a new trust that they're going to, and that might create momentum beyond just our hospital. So it's sort of a good thing, but also maybe a challenge.
Yeah. And it strikes me that, of course, any health professional or a cleaner or anybody else working in hospital environment may very well be a patient themselves. Are there any kind of things to consider around that dynamic?
Yeah, I guess, I think probably seeing it from the other side as a patient, you realise just how important some of these things are. So I think health professionals that had experience with our site, it brings kind of new insights. And I think you realise just things like just those little bits of kindness and that bits of time that people take to be supportive, to communicate well, to make you feel heard, actually make a huge kind of impact and difference. And I think as staff, if we're modelling and doing that to each other, it then kind of supports and encourages our staff to have the kind of emotional capacity to be able to do that with patients and children, young people and families, which makes a kind of huge difference to them.
I guess finally, can you are there any sort of quick tips that you would offer other trusts, other paediatricians thinking about kind of how to approach their own workplaces?
I mean, I would say that, one of the things that I think I've really taken away from this is that, small things can make a really big difference, and you don't have to do everything all at once. And I think sometimes it can feel a little bit overwhelming, especially when, faced with a sort of catalogue of things that people are struggling with and an overwhelming sense of things that you need to improve. It doesn't all need to happen at once. And actually, for me, I think that even just starting and showing a willingness and an enthusiasm to improve things actually goes a really long way. And the other thing which I know is sort of often an issue is that we don't always have access to a huge amount of funding. That's sort of been something that's come up a few times. And again, the Royal London where we work isn't, again, somewhere that's sort of hugely, abundant in resources any more than anywhere else. It's also a very deprived population. But actually we found that a lot of the things that we've done that were the most successful were free or very inexpensive. So I feel like funding doesn't need to be a barrier. Yeah, and also that we were super lucky to have both a really supportive management and senior leadership who really promoted and encouraged us. And the other thing I think made a huge difference was probably having a really engaged multidisciplinary team with the local champions. And that.
Yeah, I think that would probably be one of my top tips, is that it can, like Susie said, feel very overwhelming, kind of the issue of wellbeing across paediatrics, particularly when you take an MDT approach. And actually, I think starting by, even if what you start with is just grabbing a team of people that are kind of a multidisciplinary team of people that are passionate about it, makes a huge difference. And I think starting just by listening and asking and just trying to work out what is important to your staff. But I think as Susie says, it is the little things that make a huge difference. So sometimes you feel like, if I can't address the printers and the IT, I won't get started. But actually, just some of the sort of simple initiatives actually do make a massive difference. If you haven't got Great X and Learning from Excellence, that's a really fantastic way to start. I think that's probably one of our most successful initiatives. That's been kind of taken and rolled out across the whole site into other sites, and is a great way of just starting and kind of recognising, appreciating people, and kind of creating a culture of kind of kindness and kind of paying it forward.
Fantastic. Oh, it's all really inspiring. Thank you so much, Benita and Susie. And you've been listening to the Royal College of Paediatrics and Child Health. Thank you.